I think that most people go on a donor website and they start with what this person looks like, and that biases them down the pathway to accept some things. It's a complete loss of control to choose a donor, right? It's nothing that anybody wants to do. But there are things you can control and understand that, you can make sure your donor has had mental health screening and passed it. There's a whole generation of sperm donors that never had mental health screening. And there are many hundreds of families that suffered the consequences of young men with mental illness who went ahead and transmitted some of these heritable risks onto their children.
This episode was brought to you by Bundle Fertility. Fertility clinics, ready to boost your online reviews? Our survey of over 2,500 online patient reviews showed that 30% of the negative experiences were focused on billing or finance frustrations. Improve patient satisfaction and billing experiences by using Bundle with Medications services. See the rest of our survey results by visiting www.bundlefertility.com/IRH and downloading our exclusive report. Today's advertiser helped make the production and delivery of this episode possible for free to you. But the themes expressed by the guests do not necessarily reflect the views of Inside Reproductive Health, nor of the advertiser. The advertiser does not have editorial control over the content of this episode, and the guest's appearance is not an endorsement of the advertiser.
How do you prepare patients for third-party IVF? Preparing them in a way that grows your third-party IVF program, that provides patients with the personalized care that they need, and that sets them and their children with the right expectations for their future. My guests have a new book called Building Your Family, The Complete Guide to Donor Conception. We talk about donor egg and donor sperm. We also talk about gestational carriers, because my guests each have deep expertise in different areas in this realm. Dr. Mark Leondires is an REI. He's one of the founding partners of what is now Illume Fertility and the organization Gay Parents to Be. Mark does a much higher share of third-party IVF than average. And over the years, he shared many cases with Lisa Schuman, who's a licensed clinical social worker who has a lot of experience with screening candidates for mental health and properly preparing intended parents and donors so that they have true informed consent. Mark and Lisa talk about what criteria they need to get intended parents focused on more and what criteria they need to focus on less when they're searching for donors. With 25,000 donor-conceived siblings connected to each other in online registries, what's reasonable for intended parents to expect from donors and to expect from their practices, and what's reasonable for donor-conceived children to expect from donors and practices. Dr. Leondires talks about monetization of donor sperm and donor egg, and we speculate on what's coming in the future that might be necessary to solve for the issue of the demand for third-party IVF greatly outstripping the supply of gestational carriers, sperm donors, and egg donors. Again, the book is called Building Your Family, The Complete Guide to Donor Conception. It's available on Amazon and other places books are sold. Enjoy this conversation with Lisa Schuman and Dr. Mark Leondires. Ms. Schuman, Lisa, welcome to the Inside Reproductive Health Podcast. Dr. Leondires, Mark, welcome back to the Inside Reproductive Health Podcast.
Thank you, Griff.
Thank you.
I'm interested to explore what's happening with third-party IVF in the U.S., in the world, and then I'm interested to explore the book that you've written on the topic called Building Your Family that the two of you co-authored. Let's start with just what's happening in the marketplace. What are the numbers in terms of how much donor egg, donor sperm, gestational carrier IVF has grown in the U.S. in the last decade or some years?
Yes, Griffin, I can certainly address that. So, for myself, I'll tell you that I see very few regular infertility patients anymore. My practice is almost wholly donor conception. Everything from cisgender female couples looking to conceive to same-sex male couples to talking about people want to receive donated embryos to people, moving forward with gestational carrier cycles with donated gametes. So third-party reproduction nowadays is both, donated sperm, donated eggs, donated embryos, and the utilization of gestational carriers. And what we can clearly see in the START data, and anybody can do this themselves, if you just pull the increase in the past 10 years of embryo transfers from donated eggs, that's increased by 40%. And if you also just dig into START yourself, and you can watch the slope of the line of the utilization of gestational carriers go up year over year over year. Obviously, as with most things in our field, there was a dip in during COVID, but the utilization of donated gametes has increased. And then, we're not even aware of what's happening on the sperm donor world, in that we've asked two of the major sources of donor sperm, and they state that demand is outstripping supply. There may be some other reasons for that as well, as that we talk about in the book as far as anonymity. The other part of the story is that people are going out and finding their own donors, whether it be on Facebook, Craigslist, or a lot of these other third-party sites that are trying to match people with sperm sources. So there's an openness to using donated gametes that I think is relatively new in the past 10 to 15 years, and there's people who want to be parents sometimes, who either biologically can't be parents because they're members of the LGBTQ plus community, or perhaps they're single and they want to be a parent and they don't want to be held back because they haven't found that person or don't want to find that person. Or last but not least, there's other reasons, whether it be low sperm male factor or female factor, that they're using donated gametes. But they want to be parents, and there's lots of different ways for them to get there, and the demand for that is increasing.
So was the demand outstripping the supply? Is that part of the reason for writing the book? Tell me about why the book was written, because normally when someone writes a book, it's some monkey that they want to get off their back. It's either some subject matter expertise that they've developed such a unique point of view on that they want to share that unique point of view, or they find such a misconception or lack of total comprehension around a certain subject that they want to address that. For you all, what was the primary reason for writing the book?
You are right on point, Griffin. Exactly correct. I felt day after day, week after week, year after year, people would talk to me about their donor conception journey and the things that they wanted to do, whether it's how to talk to their children, how to choose a donor. And I would share what I knew. And people would say over and over again, how come nobody's telling me these things? I can't believe this information that you're sharing. How come nobody says it? And in part, I was informed by my own experience in the field, and partially just watching the adoption field move over time from a place where people, in the 50s, there was a large number of children adopted in the US. And over decades, we could see how those adopted children felt. And those agencies used to tell people, don't tell your children. And we saw the effects of those children and learned that we had to tell early and often. And I saw a very similar trend happening in donor conception. And yet no one really seemed to kind of learn from the adoption world, even though adoption is very different than donor conception. That particular piece was very similar. So both of those things were gnawing at me.
We are actively kind of almost trained, my generation of reproductive endocrinologists, to tell people that, you never have to tell the story to your child because nobody's ever going to find out.
Is that really the case, Mark? Were you told that when you were training?
When I was training for donor conception in the military, it happened very, very rarely. And it was something that was kind of back to my military days. Don't ask, don't tell. We're just not going to talk about it. You're a heterosexual couple. You need to use donated sperm or egg, and you'll never have to talk about it again. Because back in the 90s, nobody knew that direct-to-consumer marketing of DNA testing was going to allow us to find these relationships. And they thought the parent-child bond was going to be negatively affected by the truth, which it's the reverse.
Maybe you're starting to answer my next question that I've been thinking about. Is one version of this book could have been written by a fertility specialist. Another version of this book could have been written by a social worker. Why did this book need to be written by both a fertility specialist and a social worker, or vice versa. I'm not putting one in front of the other. Why a social worker and a fertility specialist?
Well, I think Mark and I shared a lot of cases over the last decade, and we both really saw eye to eye on so many cases that we would struggle with. And so it really made sense for us to collaborate.
So Lisa came to our practice 2017. And at that point in time, I still had a young family. I have a donor conceived family myself, and just processing how to speak to my children. And Lisa has spoken to children of donor conception, and processing how, meeting somebody's donor might be important to choosing a donor, right? And then, transitioning our anonymous program to a known program and realizing that the donors want to know where their gametes are going, at least the young women that we spoke to from our, local area. So the impetus to write the book, comes from Lisa's experience. And then I lived this life, right? And then for us both together to be working closely together and appreciating what we were hearing from the parents to be, and the parents after we changed our program a little bit, was transformational, and it just wasn't out there. There's not this type of content out there, and I think we're ready for it.
How did you each approach what you contributed? Did you like Mark writes a chapter, Lisa writes a chapter, or did you sit down at a coffee shop and jam out each chapter together? How did you each contribute your different perspectives?
Well, I think it's, pretty clearly you can see which parts are the social work parts, which parts are the medical parts you can see in the book. And we will send you one, Griffin, for sure. So you'll see.
So, as far as the storyboards for the book, it was pretty clear, how does this all work, right? And how do we need to educate our patients, our donors? And a lot of third-party reproduction is not about the medicine, it's about the people. So the book, most of the content in the book is from a mental health interpersonal relationship point of view. And, I chime in with personal stories and things like that throughout the book. The book is not a textbook. It is not a self-help book. It's basically an exploration of kind of a new part of our humanity. And so the melding of like the medical plus the personal, psychosocial, and so on is how it happened. So, chapters of the book that are medical are mostly written by me, but Lisa chimed in of like, well, people aren't going to grasp that. You need to take that down. And I did the same thing with her. I mean, this exercise of rereading your book 3, 4, or 5 times is really, quite remarkable about how to fine tune this message to intended parents, to donors, and to children, and taking care of yourself through this process. So, because this is hard.
It's really like a how-to guide. We have a very, very clear steps on how to choose a donor, which are very different than I think a lot of people would imagine. And we think it works better for most people to use this paradigm. And there are very clear ways to understand how the medical process works. There's very clear ways to understand how to talk to your children. So we really wanted to be like a how-to guide. We both went through our own fertility journeys, and we felt it was very difficult to learn everything. Even if you're in this business, it's very difficult to know what to do and to deal with the emotions involved. And so we really felt that it would be helpful for people to have a guide to shepherd them down this journey.
And part of the shepherding that you're doing, as I understand, has to do with the way people choose donors. What do you hope to change about the way people are choosing donors right now?
Well, we hope to kind of flip the script in a way. People usually find that choosing a donor naturally, even if you have always known that you needed a donor, maybe you're a single person, or maybe you're a queer couple and you feel like we are accepting of it. even then, it can be very dysregulating to choose the genetics for your child. This is one of the most intimate relationships of your life from a stranger. And so people reflexively will very often choose somebody who feels familiar to them, somebody who feels comfortable, somebody who reminds them of their brother or has the same sort of bushy eyebrows or whatever it might be. And that's nice. And you can see that the sperm and egg banks kind of play into that. They give you celebrity lookalikes and tell you how nice this person is, or show you their profile and maybe a voice message. But those things are not heritable. And as we know in our culture, we see lots of examples of people who don't look anything like their parents or don't have anything to do with, their siblings' musical talent or their other siblings' athleticism. So we know that these are not heritable. So perhaps that's not the best place to start. It's nice to like your donor. You want to like your donor because you want your child to maybe be able to meet that person one day. You want to feel good about talking about them. But it's not the best place to start. The best place to start is to try to be practical and start with the more practical aspects first. And then once that's settled and you can decide on the practical aspects to give you the best health possible for your child, then everything else is gravy.
I think that most people go on a donor website and they start with what this person looks like, and that biases them down the pathway to accept some things. But it's a complete loss of control to choose a donor, right? It's nothing that anybody wants to do. But there are things you can control, right? And understand that, you can make sure your donor has had mental health screening and passed it, right? There's a whole generation of sperm donors that never had mental health screening. And there are many hundreds of families that suffered the consequences of young men with mental illness who went ahead and transmitted some of these heritable risks onto their children. I mean, it was on the cover of the New York Times, right? Somebody with schizophrenia who's generated, more than 50 offspring, right? So mental health screening for sperm donors is actually relatively new in the past 5 years, right? Mental health screening for egg donors has always been recommended for the ASRM, and it needs to continue to be done. And so you can control whether your donors passes mental health screening and presents at a clinical interview that they are of sound mind and know what they're getting into and understand that they have there's a strong likelihood somebody's going to contact them in the future, that anonymity is gone, and they have an ongoing responsibility to the child to be, the family, and so on. I mean, the 2019, ASRM Ethics Committee on, donors and donor conceptions, their comment reads like this, and I have it up because I think it's important and really well written. Donors, recipients, and programs must recognize that they have a unique and ongoing moral relationship with each other, and this obligation does not end with the procurement of gametes or the donation of embryos. Evolving medical technology, laws, and social standards will likely require reevaluation of these relationships throughout the lifetimes of the parties involved. So we'll unpack that a little bit maybe a little bit later on, but this is an ongoing relationship. And I think that donors didn't always understand that, or wasn't always driven home, and maybe not always driven home by the medical providers that were interviewing them. So mental health screening, clinical interview, and family history. Listen, when you're choosing a donor, you're not getting them. You're not getting their picture, who they are. You're getting their family tree, probably their past 3 to 5 generations.
Right.
Understanding that when somebody sees a donor that they like, they should pass that to the side and go right to their family tree, right? And then genetics. Like, we all know there's recessive genes that cause disease, right? So that's something you can control and make sure was done, that you did it yourself. And then also think about the things that in your own family tree that you don't want to replicate or increase risk on, because we all have things in our genetic closet. So if you start basically with those 4 issues, the donor's looks and because it's a male sperm and egg donors, right? What you see becomes less important. So one of the goals of the book is to for intended parents to give them a sense of what they can control, and to reframe how people go about choosing donors. And I think it's also a message out there for providers, for mental health professionals, for nurses, for everybody out there in this industry. So we're in this industry of basically procuring gametes so people can have babies. But these gametes eventually become people, right? People with lives who have questions and so on. So we want to make sure that the intended parents are really thoughtful about how they choose a donor. And of course, everybody's going to say, well, I didn't just choose a donor because of what they looked like. But understanding that if you exercise as much control over the first 4 things I mentioned, you're going to have a really nice story to tell your child about why you chose that particular donor. So I think that, that's a big part of the book, changing the conversation on how people find their donors. And the other parts of the book that I think are really powerful are, how to talk to your children as well.
Is your fertility clinic facing billing and communication challenges? You're not alone. Bundle Fertility's data from over 2,500 reviews reveals that these are common pain points affecting clinic reputations. That's why we designed Bundle Guard with Meds to help improve the patient experience and alleviate the top drivers for negative reviews. Not only does the patient get a full refund guarantee, but they also receive a concierge team to handle all of their billing and financing questions. We unlock staff efficiencies so they can spend less time reviewing bills with confused patients and spend more time providing the best care possible. Visit bundlefertility.com/IRH to learn more and download our internal survey of patient online reviews to analyze what gets clinics 1 to 2 stars versus 5-star ratings. That's BUNDL fertility.com/IRH.
So you're steering people away from first looking at attributes of appearance, and you're steering them to more practical criteria, such as their mental health screening, their clinical interviews, their family history. As a marketer over the years, I have learned that the market gets what the market wants. And
Yes.
that's not always a great thing because people don't always want things that are the best for them. They don't always want things that are ethical. They don't always want things that are sustainable. And so if one is going to try to go against the market, they got to find a niche that's receptive enough to it, and they have to find a way of leveraging that message to where people start to see something else that they want more. So how are you doing this in this chapter, in this part of the book where you're trying to get people like, no, I want 6 feet tall. I want Harvard educated. I want blue eyes and red hair. How are you getting people to think differently?
Well, a couple of things. First of all, I mean, we give examples. I mean, even in our culture, right? The 2 princes of England look very different from each other. Our ex-president Bill Clinton was a Rhodes Scholar, president of the United States, and his brother is an alcoholic, right? So people are not like their siblings. But also, if you think about our paradigm instead of just the way that we reflexively think about things, because we're anxious, really that's where it's coming from. We're anxious about choosing somebody we don't know, right? So we want something familiar. And I think when people understand that, they can be a little bit more reasonable about their decision. Also, it narrows their choices. Patients often come to Mark and I saying, I feel completely overwhelmed. I'm looking at this sea of like Match.com people. I don't even know where to start, right? So if you start with, did they have mental health screening? Right away, you're narrowing the pool. Do we have replicated risks? You're narrowing the pool. All of a sudden, you're narrowing the pool and it makes the whole process so much easier. Also, I think that, we do make the point of why all of these things are important. Mark and I were just talking before this podcast, that someone suggested to me that one of these people who's pushing for legislation that clinics should investigate all donors and do thorough background checks on them in order to prevent mental health problems. And one of the families who unfortunately lost their son through suicide is one of the people who's doing this. Unfortunately, that I think is sadly unreasonable. First of all, no clinic has the ability to do that. Secondly, it's not feasible. You can't find every single person's every doctor appointment, every time they went to mental health counseling, every time they were prescribed everything. And last, no one has a record unless they're convicted in this country. So you could have people who are mentally ill, who are doing all kinds of things, and if they're not convicted, there's no record. So what's really the point in doing all of that when you can just do mental health screening and get a much better picture of that person? So we try to make reasonable arguments for all of our suggestions.
And specifically addressing your question, how we hope to change hearts and minds is by thinking about the fact that as a parent someday, you're going to do all these other things that are uncomfortable that you don't want to do. So your parenting is going to start by trying to find the best family tree, genetics, story, mental health screen donor. Of course, they're going to be appealing to your eye, right? But that is not what your kid's going to care about. And what do we want for our children? We want them to be healthy first, have good emotional well-being to find happiness and love and live their lives, and to be smart enough to leave your house, right? And that's none of that's how we traditionally find donors. So changing hearts and minds is like also thinking about, why did you choose your donor conversation with your child? And it's a conversation that develops over years. And I will tell a story that just happened recently to me. So we're driving back from a family event with my two kids, and I have a 12-year-old and a 10-year-old, and we're talking about the donor because I always called her the donor, and discussing that she might have her own children right now, and my 12-year-old said, "Well, that means I might have a sister." I said, "Yeah," and he said that could be cool. And my 9-year-old, who's usually a little bit thoughtful, is just hanging out back there, and so I asked, what do you think about this special lady who gave us some of her cells? And then I said, what should we call her? I think she needs a better name than the donor. And he paused and said, our fairy godmother. Which for me, that's kind of what these people are, right? They're giving us this human magic that allows us to have families. So being really thoughtful in choosing the donor is also going to make for very strong relationship and bond and ability to talk about with your children why they chose their donor. And that hopefully means that they're launched into adulthood with a good sense of self, that they were very much wanted and loved before they even came into existence. Right now in the New York Times this week, there was a story about donor conception. There's a popular book right now that talks about finding out that, my genetics are not my genetics. Most recently at the SREI conference, which some of the listeners went to, there was a very heartfelt video about somebody who found out that later in life, that who they thought they were the whole time is not who they were. So how to change hearts and minds is that you're going to do this for your child to be, because you already love them. So like within the book, changing the paradigm, getting that message out that anonymity is gone, doesn't exist anymore. And with more openness, hopefully comes to a better place for all these families to be. And it is something that our field, I think, culturally needs to change. At this same SREI conference in the 1950s, people were like, the donor there, it did not matter. It wasn't something that was going to be revealed about choosing if you use donor conception. And now, there's a whole bunch of donor conceived people who have a voice. There's 25,000 donor conceived siblings that have been connected on donor sibling registry. And these taking what we know now and moving it forward for the thousands of people, hundreds of thousands of people in the future who will proceed with donor conception is one of the reasons we wrote the book.
Do you talk about what's reasonable to expect from donors, from the part of, I guess, donors and providers, from the part of the intended parents and from the part of the children of donor assisted reproductive technology? I think you were talking a little bit about that, Lisa, but I remember at ASRM this year, there was a small crowd, 10, 20 people at most outside. I don't know what their grievances were, so I don't want to misrepresent what their grievances were. I've also had Igor Brusel on this program, who is an embryologist turned reproductive health attorney, and he said some of what is being asked for by some people from the donor conceived community in certain legislation is things that we would never be able to get from our biological parents, and so it isn't reasonable to ask for those things. It isn't tenable to ask for them. So do you talk about that all in the book? What the limits that intended parents and children can expect from donors and providers?
There are a lot of limits, and that's a whole nother conversation, because there is some division, I think, between people who are donor conceived, and what we find is either found out about their origins accidentally or found out late, and those adults are usually very distraught over that. So there seems to be a division between those people and then the younger donor conceived people who seem to feel a little bit better adjusted. And so there's a lot of difficulties, I think, as time goes on, as there was similarly in the adoption community, until things change. So, and we don't really go into that in the book. What we're really talking about is that when you're going through fertility treatment, you have to make all of these big decisions, and you're really focused on getting pregnant naturally, right? That's what everybody's focused on. Let me make a lot of embryos because I want to have as many embryos as possible. I need to build my family. I need to get pregnant. And understandably, the patients, the doctors, everybody is kind of focused on that. And yet now we really have to think into the future. We really need to talk to the donors about what the implications are for their future. These people will reach out to them. What's it going to mean for them? What's it going to mean for their family? What's it going to mean for their future partners? What's it going to mean for the children and for the recipients? Do they really understand what they're getting into? And it's really important for them to think wisely about all of these pieces of the puzzle before they do. So we're really helping the people who are just beginning this process.
So what is it that fertility practices need to know about the changes in donor conception?
Well, the fertility practices really need to start to think a little bit differently, right? We're all kind of conditioned to think about pregnancy. That's what we're thinking about, a happy pregnancy, and that's wonderful. But we now have to think into the future, right? Just like the ASRM statement says, we're all part of making this happen, and so we all have a responsibility to really think about what we're doing. How are we talking to the donors? Are they really well informed? Do they have true informed consent in a way that's different than what we were trained to do decades ago? Are the recipients really educated about how to talk to their children? And do they really understand what that means? And, as we move forward, there are a lot of donor-related siblings. Last year there was a live birth from a 31-year-old embryo. So we have many, many generations of donor-related siblings that are going to be coming around decade after decade, and that's not going to stop anytime soon. So we really need to be thoughtful about all of these things and prepare for the future, not just for getting pregnant.
Yeah, I mean, I think that the fertility clinics need to know that that anybody who's thinking of donor conception needs to understand that there's no way to keep things anonymous, I think that if you're speaking to any donor, whether it be a sperm donor or egg donor, that they need to be aware of that. The other part of the story is that moving towards openness, whether it be an open egg source or open or a familial or a family member or friend, the legal aspects of this are important. So, in this whole third party reproduction field, it's clinicians, doctors, nurses, embryologists, it's mental health professionals, and it's reproductive attorneys that all need to work together to protect the donor's rights, the parents' rights, and the children's rights. And it's it's just a lot more complicated than just getting somebody pregnant. It's thinking of the long-term implications of what we do. And so I think, changing the way a fertility practice thinks about, well, we're just going to help them get pregnant. It needs to go to, well, we need to be really thoughtful about making sure everybody's properly educated and that they have they understand all aspects of how donor conception through a fertility practice affects these families to be.
The first time I had you on the show, Mark, was because I have so many people in the audience that want to do more third-party IVF. They want to attract more gay male couples. They want to do more donor IVF and more GC IVF. But it's not just as simple as just saying, hey, we do this too. There's an infrastructure, there's an investment that needs to be made. And you've invested a lot in this. So talk to me more about the specifics of when you say that it's the docs, the nurses, embryologists, and the mental health professionals working together. What does that look like specifically?
I think that the third-party team at every fertility practice needs to really have a very strong kind of interdisciplinary bend, meaning that, it's easy for you to speak to a reproductive attorney or mental health professional. And I think that, our field is, a lot of aspects of our field are being commoditized, sperm and egg included, and understanding that that the third party team is it's so much more than you just need a donor, right? It's you need to think forwards and backwards and try to guide people to make their best decision. So as people want to do more and more third party, I think it's really important that there's a separate part of a practice or a dedicated team that moves, stays up to date and understands what's happening in the field. I mean, there's a beautiful conference it's the Donor Egg Conference that happens every year. That's basically all dedicated to the legal, medical, mental health aspects of donor conception, right? And I think that if people want to, grow this aspect of their practice, understand that there's a lot to it, and they need to be able to pick up the phone and ask questions and stay up to date with what's changed, because a lot has changed, right?
And we also need to understand, and Mark and I spend a lot of time talking about difficult situations with known donors. As time goes forward, more and more people are going to use their friends or family members as donors. And certainly you have people in the trans community who are going to have more and more children. We've had people who are in thruples. And so, it's only going to get more complicated. And there are, educational pieces that really need to be part of this practice to help the patients understand and work through all the potential difficulties and implications for these situations. And there are a lot of ethical issues that arise in each one of them, and we have to really be thoughtful about them.
You mentioned, Mark, that we're starting to see a bit of commoditization happening, sperm and egg included. That brings me back to a thread you pulled at in the beginning of this conversation about the supply and demand, and that the demand is outweighing the supply of available donors, gestational carriers. So would commoditization possibly be a good thing, that you have more of a scale to provide the supply for the demand, or is it a bad thing?
I actually think that um, with driving home to donors, the loss of anonymity, there may be fewer sperm donors, probably not fewer egg donors, right? There's much more greater demand for sperm donors than egg donors, because the young men who were donating sperm, I think, 10, 15 years ago, didn't think that there was any future implications for them. And I think that so what we've seen over the years is the compensation for donors has gone up and up and up, and the cost per donor sperm has gone up and up and up. The compensation for surrogates has gone up and up and up. So I think that I think commoditization is not going to increase availability, because the humans involved are getting a better understanding of what the commitment is, and they're not just donating their eggs or donating their sperm. If we're doing our job right, they understand that they're helping a family come to life, and there's a future child that may come knocking on their door, and for the sperm donors who were doing, had the best intentions, most likely, who ended up having 100 children out there, that's not something I think was done well, right? I can't imagine being that young person who realizes that I have 99 half siblings out there. Never mind the 40-year-old man who realizes that he has all those genetically linked children out there. So things are changing.
So, and some of that absolutely needs to happen, because if you consider us as a species, if I have my statistics right, we have twice as many female ancestors as we do male ancestors, meaning that some men were reproducing a lot, some men weren't reproducing at all, which tends to be common among species. And so you might have people a few decades ago that there was a Pareto's distribution where you had some sperm donors donating too much, but you also might now have, just because you are more properly informing donors of what the involvement and the commitment is, as you stated earlier in the conversation, I think you called it an ongoing ethical relationship between donors, recipients, and the program. And so as you start to give people the proper informed consent, it becomes harder to recruit than if there's no strings attached, which is necessary. But then how do you amplify recruitment?
I think there are more known donors now as a result of it. I think that's just going to happen. What do you think, Mark?
Yeah, I think no donation is going to come into the forefront, and then as long as it's done well, and with full disclosure and the right legal documentations, it should limit the amount of families that are made from any particular sperm source. And we already advise egg donors not to donate more than 6 times, but it likely will limit that. So, the governor, so to speak, on donor conception is likely going to be the donors themselves. I don't know, Lisa, what do you think about that?
Yeah, I mean, I think it's very important. Decades ago, I don't know if you remember, but decades ago, there was an article written by a mental health professional in Fertility and Sterility about a clinic where they had this ethical dilemma where they cycled two families who used the same sperm donor and the same egg donor by sheer coincidence in a very small town in Westchester, in New York. So these 2 little kids were born around the same time in the small town, probably, went to kindergarten together, and hopefully they won't go to the prom together. This is, a problem. So people really need to understand, even even the limits that we have are very large right now.
And I just want to dial back. It's not that Mark had that statement. It's the American Society for Reproductive Medicine Ethics Committee that has that
Yes.
statement.
Yes.
We have this ongoing relationship
Yes.
or commitment and moral obligation. But I think that
So what do we do to get more donors, though? Because it sounds like that seems to be pretty common across the board. Not enough gestational carriers, not enough sperm donors, not enough egg donors. And the U.S. is sitting in a lot better of a position than a lot of countries are. A lot of people are coming to the U.S. because there's none or very few in their countries. So what needs to happen in order to have more donors and more gestational carriers?
Well, first of all, a lot of the reasons why there's no donors in other countries is not considered legal or ethical, right? For those things.
And they can't compensate even in the countries like Australia and New Zealand, Canada, where it is legal, there's rules and limits on compensation. So is the answer only more compensation? Is it public awareness? Is it some change in the messaging? And if so, what does the message need to be?
I don't have a clear answer to how to solve that equation of supply and demand. My impression is that there's not going to be as much supply because of the donors and practices and intended parents understanding, this process better. The future of this may be the future of science, where we're able to take stem cells and make them into sperm and egg, and then nobody needs a donor anymore, right?
Right.
And so that will solve that problem. And then this whole industry goes poof, right? Which is kind of an interesting comment for your show, right?
They're working on it. I saw the CEO of one such company speak on that earlier this year. And maybe we'll have to have that person on the show, because maybe that is ultimately the only solution. Maybe there isn't enough supply from what we currently have right now. But I think that also points to the importance of what you're discussing earlier in the show in terms of preparing intended parents to look for the right things, that at least they're not wasting their potential supply source by looking at things that are either superficial or it's just simply not as important as the practical criteria that is.
Yeah, and one other thing, Griffin, that might also be happening in the interim. Mark and I talk about this as part of a talk that we give. There are all of these new small companies, you're probably familiar with them, like Modamily and a lot of other groups that are developing. And I think there is this ongoing need for more transparency. And as the donors, and I spoke about this at the Egg Donor Conference, as the donors start to feel a greater sense of agency, maybe more power in the relationship, more interest in choosing maybe their recipients, there'll be more matchmaking companies perhaps where people will decide, maybe I want to donate. And I have actually on my podcast a couple of donors like this who decided they wanted to donate to specific people where they could have an open relationship and they meet people they like, and that's really the end of the story for them. So there may be more of those sorts of relationships that it will develop over time. Of course, that's a smaller number than the large sperm banks provide, but there may be a rise in that over time until we come up with the science to make children from stem cells.
I think it's useful for providers to pick up a copy of your book, and not just providers. We also have nurses, we have practice owners, we have business suite folks that listen, we have reproductive health attorneys, we have mental health professionals that listen, people that work in our field, anyone that touches third-party IVF, I think could benefit from reading your book. Each of you have a concluding thought of what you would like folks that work in the fertility field to take away from your book.
So for myself, I think that understanding that moving forward with recommending your patient pursue donor conception needs to then be followed through with making sure they understand, how to choose a donor, maybe reasons to think about an open donation, and what is the best and how to talk to their child in the future, so they fully know that their parents did everything they could to bring them to life as a happy, healthy, well-adjusted person. And that will not only bring these parents to be joy, but it also will bring that child to adulthood and hopefully as a committed, helpful member of society.
Yes, I echo that completely. And I hope that patients don't feel discouraged. We know how stressful fertility treatment can be, even when you don't have infertility. And we want patients to feel like this is all possible. There are paths to parenthood that can work, and you can learn these things, and you should be armed with this knowledge and feel confident that you can move forward and create the family that you want to create.
The book is called Building Your Family, The Complete Guide to Donor Conceptions.
Donor conception.
The authors are Dr. Mark Leondires and Lisa Schuman. We will link to links that people can pick up the book, but if they're driving in the car right now and for them to remember later on, where can they pick up the book?
The book is available at Amazon, Barnes & Noble, Macmillan Press, and it's also as an audiobook. And I really want to thank you for having us on, and appreciate your podcast and the work you do. And this is a very multidisciplinary podcast. So there's a lot that you do for our industry. So thank you so much.
We really appreciate it, Griffin. Thank you.
Thank you both for coming on.
This episode was brought to you by Bundle Fertility. Fertility clinics, ready to boost your online reviews? Our survey of over 2,500 online patient reviews showed that 30% of the negative experiences were focused on billing or finance frustrations. Improve patient satisfaction and billing experiences by using Bundle with Medications services. See the rest of our survey results by visiting www.bundlefertility.com/IRH and downloading our exclusive report.
Today's advertiser helped make the production and delivery of this episode possible for free to you. But the themes expressed by the guests do not necessarily reflect the views of Inside Reproductive Health, nor of the advertiser. The advertiser does not have editorial control over the content of this episode, and the guest's appearance is not an endorsement of the advertiser. Thank you for listening to Inside Reproductive Health.